Hi, my name is Claudia. I'm a registered physiotherapist in Proactive. I work in the East location in the Danforth. And today I want to talk about a couple of strategies to alleviate tailbone pain when you're sitting down. Um, Tailbone pain can come from a direct trauma, falling on your buttocks. It can come from severe constipation or bowel issues that are tensing up that back of your pelvic floor that is attached to your tailbone. It can also come from a stiff upper back, stiff hips, a stiff lower back, or issues where your posture is not that dynamic and you are forced to be sitting, or because of work, you can't take too many breaks and get up from that chair. Think about also about a long trip where you can't get up because the seat belt is signal is on. So one of the main things is, if my knees are higher than my hip, it's going to be uncomfortable. So what to do in this position? Make sure that you're able to sit a little bit more forward with your knees a little bit below your hip to force your hip to tilt and release the tension in the back. You can use pillows on your back to support you. Or if you're going to sit all the way back, make sure that your buttocks are all the way back and put something there to support your legs. And try to make sure that your sit bone is not touching and holding your weight. Another thing is that in surfaces that are a little bit harder to sit on, you may have a pillow in the bottom. But the other thing is that these chairs are not dangerous. It's your tissues being more sensitive. So something that you may want to do is make sure that in your sitting position, you're stretching your hips, different shoulder, figure 4, opposite shoulder, that you're able to move your knees in and out, and that is gonna move also your pelvic floor and that pelvic floor that may be tight because your tailbone is stuck in. You also want to make sure that you add a little bit of pelvic tilt to release your hips, pelvis, lower back, mid back, and release all of that tension. Make sure that if you're sitting on something that is more firm, that the weight is on your thighs and your buttocks, there on your sit bones. So right now it's mostly on something that is more cushion, that in a bone like the coccyx or tailbone. And that can help you feel a little bit better. I hope this helped. If you need to look for any other strategies to help you alleviate pain, or you're thinking that maybe pelvic floor is connected to that tailbone pain that you're having, please reach out and we will be able to assist you with this. Thank you.